Welcome back to our channel for video 2 of our series on COVID-19 or the coronavirus pandemic. The first video we highlighted what exactly the virus is, so be sure to check that video out if you missed it. In this video, we want to discuss how this virus is transmitted, what symptoms may present, and who is most susceptible to infection. So let's dive right in. How is the virus transmitted? It's spread from person to person, similar to the flu. So cute. Usually it's transmitted by respiratory droplets from an infected person's cough or sneeze. It's unlikely to be spread by touching an object with the virus on it, as this virus family does not survive long on inanimate objects. At this time, it is also not known if weather and temperature impact COVID-19 or not. Infected people are thought to be the most contagious when they are the most symptomatic or the sickest. But please keep in mind that someone could spread the virus without showing symptoms.
Speaking of symptoms, which are the most common ones? Symptoms include fever, cough, and shortness of breath. These typically appear 2 to 14 days after exposure, which is a really long time. Severe symptoms include persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips. If you experience any of these, contact your doctor or the emergency room and seek medical attention immediately. If possible, alert the medical team that you think you might have COVID-19 before you come into the office.
So who is at highest risk for exposure? The immediate risk of being exposed to this virus is still low for most Americans, but as the outbreak expands, that risk will increase. The people who are at the highest risk of exposure are people in places of ongoing spread of the virus, healthcare workers caring for patients with COVID-19, and close contacts of persons with COVID-19. Now, who is at highest risk for severe illness? Early information shows that older adults with risk increasing with increasing age, and people with serious chronic medical conditions like heart disease, high blood pressure, diabetes, and lung disease are at highest risk for severe illness.
So with all that said, we want to reiterate what we said in the previous video. Many of us are at a low risk for exposure and low risk for severe illness, but please don't take this lightly. Think about others around you that may be at a higher risk and listen to the advice of officials as they learn more information about this pandemic. Tune into our next video in the series as we discuss ways to protect yourself during this outbreak, and then our final video with information for our breastfeeding moms. As always, reach out to our staff here at River City Pharmacy for more information about the virus and ways to support and optimize the immune system. Bye!
Bye!